So in today's class we will discuss very little about on the basics parts about ATCOM in microbiology. ATCOM is a short form of attitude, ethics and communication. Right now what you are pursuing is what is known as competency based medical education recommended by the National Medical Council. Okay. So according to this, what is the target? Is to make you what is known as an Indian medical graduate. What the Indian medical graduate should possess, not only knowledge but also skill, attitude, values and responsiveness. Okay. So knowledge is not only sufficient, you need to also cultivate the attitude and the ability to communicate in all the scenario, including the patients and patient related activities. Okay. And even with the colleagues. So what would be the role? You should be a clinician who understands and provides what type of management, preventive, promotive, that is promotion of good activities, curative, palliative and holistic care with compassion. Furthermore, he should be a leader, he or she should be a leader and the member of the healthcare team. Hence, should have the capability of intermingling with other members and when required be the leader of the team. To do that, he should be an effective communicator not only with colleagues, patients but also patient skin. Furthermore, if you have to be this sort of thing, you should have the ability to learn throughout your lifetime. It is not that over the period of 4.5 and 5 years you have learned, you have completed your studies, but your learning does not end there. Your learning continues throughout your life. And most importantly, he should be a professional. When I say be a professional, I also try to inculcate these things into you. Just off the topic, I am asking you a simple question. What is the importance of going to a school or college? The most important thing to attend a school or college is to be on time for a period of time, say 3 years or 4 years, and complete the activity that is being given to you in the stipulated time with a degree of efficiency. Why is it important? Because when you do that, you are given a certificate for the recognition of your effort, so that other people can recognize what have you done in the past, and henceforth it is expected of you to do the same throughout your life. If you can't attend a class on right time, how can I be sure that you will be attending the patient on right time? You can't, because right now you have no responsibilities. You have no responsibilities of your family. You have no responsibility of your patients. Yet you are faltering. So ask yourself, when all these responsibilities will land on your shoulder, how will you perform? So this is the very first step of being professional. Okay. If you are healthy enough to attend the canteen for your meal, you are healthy enough to attend the classes. Be on time, try to study hard. Nobody will judge if you can't complete the task that is given. But you should have the right attitude that you have at least tried to complete the work. That is the first step of being a professional. Agreed that no one is 100% complete. Perfection is not attained. But you have to try for that. This is the attitude that you should inculcate. Have you understood? Okay. So in short, you have to be a clinician, you have to be a leader of the team, an effective communicator, you should be a critical thinker, you should have the ability to do the research activity. Why? Because many a times many problems might come up and you have to find the solution for it. Be it an outbreak in your ward, or be it be a certain scenario. The only way you can do that by two ways. You have to keep an open mind, you have to learn throughout the life, and you should always be ready to accept the new challenge that life throws upon you. Okay. I have already told is the attitude, ethics, and communication. So, what is attitude? Attitude is it's a settled way of thinking or feeling about something, right? Someday you might feel many of you will be playing some sports, outdoor sports. For example, you are playing football. So some days you might feel okay, let's play today, and some of it I don't feel like it. So that is the attitude. As long as this attitude is there for recreational activity, it is fine. But for your professional activity, you can't have this sort of attitude. आज अच्छा नहीं लग रहा है, मन नहीं कर रहा है, अरे बाहर बारिश हो रहा है, कौन जाए कॉलेज, क्या फर्क पड़ता है? You can't say that. When your patient admitted in the ward, can you say that? अरे बहुत बारिश हो रहा है, नहीं जाएंगे आज. किसी को बोल देगा वो देख लेगा. You can't have this sort of an attitude. Then comes ethics. It are the moral principles that govern a person's behavior or conducting an activity. Sometimes many people do a lot of things that you feel that is not right. It's not a crime, but it's not right to do so. Right? Let's take an example. Out of the medical context, a child does something wrong. You may see one parent beating the child, one parent abusing the child, another parent trying to make the child understand why what he has done is wrong. All three have different attitude and they have different ethics. For a growing child, you need to make the child understand what is right and what is wrong. If you go and abuse a child, that is ethically wrong. It is not a crime. A mother can beat her child, but that is ethically wrong. Similarly, if somebody misbehaves with you, if you also misbehave with them, it's not a crime, but it is ethically wrong. So you must understand what moral ground you should hold while you are performing your professional activity. Remember that you are the clinician, you are the doctor. You have to hold the higher moral ground because the person in front of you may or may not hold. You are not accountable, but you are accountable for your own ethical consideration. Always remember that. So, ethics means when you are dealing with the patient, it will have four parts. First is autonomy, next is beneficence, third is non-maleficence, and finally fourth is justice. Let us see each and everything. Autonomy. Autonomy means allowing a capable person to exercise the right to make his or her own decision on facilitating making a decision making. क्या मतलब हुआ इसका? समझ में आया कुछ? All the English jargon. It's simple. When you are dealing with a patient, he is more than 18 years old. If he can or she can make his or her own life's decision, he or she can also make the decision regarding the treatment protocol that should be followed. Remember, it is the patient who takes the decision. You are not there to choose for him or her. What you need to give the patient is all the options and their effects. Have you understood? He may have no medical knowledge, but you cannot choose for him. That is patient's autonomy. If after knowing everything, the patient refuses treatment, you cannot force him treatment. However, if you don't inform all the effects of the disease to the patient, unknowingly he refuses treatment, then you are at fault. You have to explain the patient what the disease is, what are the treatment options, what are the effects of treatment A, what are the effects of treatment B, what would be the outcome. You have to explain each and everything to the patient. After that, whatever treatment or no treatment he or she may choose, you have to accept that. Okay, that is autonomy. More important part is you have to respect the privacy of the patient every time, including privacy from his or her own family. Okay, a patient comes to you and discloses everything he knows based on the belief that you won't disclose to anybody without his or her consent or knowledge. Just because a patient's husband comes and demands to know you whatever is happening from you, you cannot let him know. You have to respect the privacy of the patient at all times. Next part is, when you are trying to protect the privacy, you must protect what is confidential. आपने privacy तो पूरा protect कर दिया, पर prescription किसी का हाथ में दे दिया. So you are not keeping confidential. Similarly, laboratory reports are also of privy and confidential. Okay. Now laboratory reports are there to communicate from the laboratory to the clinician. The clinician and the laboratory should always take matters into their own hand so that the information remain privy and confidential. Next part comes is beneficence. Beneficence means the patient's right to improvement or restoration of the health. That is, you should act to protect and defend rights of the others, to prevent harm from occurring to others. You have to remove all conditions that cause harm, help the patient with disability, and rescue the persons in danger at all times. Let us take an example. Say you are working in a medicine ward. Suddenly a patient is admitted with a known psychiatric disease, prone to manic episodes. You may have to restrain the patient. Why? Otherwise, the patient may be harmful to other patients, other healthcare workers. Okay. But restraining a patient is not a good thing for that person. But sometimes you have to take these decisions. This is for the beneficence. Similarly, you also have to attend that patient. Just because he or she may endanger other patients doesn't mean you will neglect that patient. You have to attend that patient. You may have to sedate that patient. You have to treat that patient, but you cannot leave him or her. Okay. Next comes is non-maleficence. What is maleficence? Do you understand the word maleficence? Ichhakrito, deliberately harming others. Okay. Many a times in your working life you will take decisions which may harm somebody. Okay. Always remember, whatever decision you may take, some person may be harmed. But what is very important is that whether that harm is deliberate or not. You cannot do anything deliberately. Like, do not kill, do not cause pain or suffering, do not incapacitate, do not cause offense. Sometimes you may cause pain. Suppose you are trying to reduce a fracture, that reduction will cause pain. You have given painkillers, it will take time to act or is not sufficient. The patient may complain that डॉक्टर साहब क्या दवाई दिया, दर्द तो अब भी हो रहा है, but that is not delivery. You have given the drug. Maybe it may not be optimum. Maybe you cannot give the optimum drug because of other clinical condition the patient may have. Okay, but you are not deliberately harming the patient. Similarly, in an operation theater, patient may die. Many reasons are there. Many reasons are there that are out of control of the doctors there. But nobody is deliberately trying to kill the patient. Right? So some things are actually not acceptable. These are those things. Okay. Now do not incapacitate. For any operative surgery, you need to give anesthesia to the patient. General anesthesia. The patient becomes incapacitated and then you operate on. But is it done deliberately? No. There is a particular objective, that is to perform a surgery. Otherwise, will you incapacitate any other person otherwise? No. Okay. So that is the reason why, please keep in mind, the terminology is non-maleficence. Maleficence means deliberate harm. So harm may occur, but that is not deliberate or intended. Next comes is the word justice. So what is justice? You are not a judge. Over here, the justice means fair and non-discriminatory distribution of the limited resources and prioritizing the need and distribution proportionate to the need. Why this is important? Because of two reasons. First of all, when there is a resource limited setting. Second, when there is an urgent need, like in a case of emergency. How many of you have heard the word triage? Triage কথাটার নাম শুনেছো? না। Triage মানে হচ্ছে, let me explain. Suppose there is a railway accident. Many patients are being brought to the emergency. Only 2 emergency doctors are available. Many dead bodies have come. Many patients are mutilated, legs amputated, bleeding profusely. Some have concussion, head injury. So whom will you treat first? There is a proper protocol. You cannot attend each and every patient. So you need to triage the patients. That means you need to categorize the patient, whom to treat first. So what would be your priority? Your priority should be attend to those patients first in whom only minor treatment is required and they have high probability of survival. Then attend those who need a moderate degree of treatment and have a high probability of survival. You won't go and treat some patient who need huge medical intervention, yet the probability of survival is very poor because you are in a resource limited setting. Okay. So obviously, if you are doing triage, the person who is almost dead, his patient party might or his relatives may claim that you have not attended to the patient. That is also wrong from their point of view, right? Simple question. If there are 2 patients who are injured, one is a 5-year-old child and one is 90-year-old man, whom will you attend first? Obviously, a child has a higher probability of survival. Okay. But does that old man deserve to die? But you have to choose. Why? Because either in a limited or resource limited condition or in an emergent condition, you have to choose. So when you are choosing, you have to follow this thing. You should try to give equal attention to all patients. You should try to treat each and every person according to their need. Okay. then your effort, contribution, and should be based on each and every patient's own merit. That is the justice we have to do. Okay. Please remember these three terms: confidentially, privacy, and trust. The patient comes to you with full trust. You should also trust the patient. Whatever information he or she is sharing with you, you should keep it confidential and maintain the privacy of that information. Remember, all those informations are not for you to share. Yes, you can share. When, say, the courts order you to share, then you will share. In legal jurisdiction, if there is an order for you, then only you will share. Otherwise, you will share with no one, not even your colleagues or your spouse. That's the level of confidentiality and privacy you have to maintain. Okay. Even in your scientific communications, say, during your working time, you find a very interesting case, you want to publish that case in a journal. You can describe the whole clinical condition, but nowhere you can disclose the identity of the patients. You can take photographic evidence after obtaining permission from the patient. Even then you cannot, you have to, have you seen in some books? Why? Because the person can be identified if by the photograph from the eyes and the intercanthal distances. Okay. So these things you have to keep in mind at each and every step of your life. You must also know what are the rights of the patients. So what are the rights of the patient? He has the right to confidentiality. He has the right for non-discrimination. Discrimination may be anything based on racism, casteism, and also economic discrimination. Okay. Just because the patient is poor, cannot afford the established treatment protocol in the hospital that you are working, that doesn't mean you will not offer him any alternative protocol or a low cost protocol. You cannot discriminate on that fact. Similarly, has a right to informed consent. What is informed consent? Informed means the patient gives consent for the procedure or treatment after he or she has learned everything about the procedure or the treatment protocol. If he or she has not understood in their own language, then there is no consent. So if a patient is unable to comprehend what is happening, for example, somebody with a altered mental status, will he or she will be able to give consent? No. Similarly, a child cannot understand what is happening. Their consent is also not valid. Okay. Right to choose the source of obtaining laboratory result. The patient has the right to choose the doctor. पेशेंट आके बोल सकता है मुझे वो पसंद नहीं इसलिए आपके पास आया. आप नहीं बोल सकता कि मुझे वो आदमी पसंद है इसका ट्रीटमेंट नहीं करूंगा. बट द पेशेंट हैज द राइट. सिमिलरली पेशेंट आके बोलता है नहीं वो वाला लैब बहुत घटिया है वहां से नहीं करूंगा यहां से करूंगा. यू हैव टू एक्सेप्ट दैट रिजल्ट. ऑब्वियसली दैट लैबोरेटरी शुड बी एक्रेडिटेड लैबोरेटरी. ऐसा नहीं कि कुछ भी उठा के ले आए. नेक्स्ट इज right to protection from participants in biomedical research. इसका क्या मतलब है? Many biomedical research is going on. Human beings are involved. Always remember, if a patient is a participant in a research, he or she is not a guinea pig. He or she is a human being. They should know each and everything about the treatment protocol, procedures, and if any adverse effect occurs, they should be properly treated on based on the established protocols and should be compensated. Understood? Final part is right to be heard and seek redressal. इसका क्या मतलब हुआ? Suppose a patient is not satisfied with the treatment at a hospital, he or she can go to the court. That is their right. आप नहीं बोल सकते मैंने पूरा कोशिश किया नहीं हुआ तो जाओ भाड़ में, नहीं, आप नहीं बोल सकते. You have to accept the decision. Now if they have rights, they have responsibility also. What are the patient's responsibility? They should keep appointments. Suppose आपने पेशेंट देखा और बोला कि 1 महीने बाद मैं फॉलो अप करूंगा, आया ही नहीं, तो पेशेंट इज इनकॉम्पिटेंट. इसका क्या मतलब हुआ? आपने एफर्ट दिया, आपने पेशेंट को मॉनिटर किया, आपने रिकमेंडेड ट्रीटमेंट भी दिया, काम नहीं किया, उसके 3 महीने बाद आके बोला कि आपने सही से ट्रीटमेंट नहीं किया. Will you accept it? Obviously no. If you are putting an effort, the patient also put their effort on their side also. Okay. Let us take an example. Say you are handling a patient who has, you have diagnosed as a case of pulmonary tuberculosis. You have started on anti-tubercular drug, and now the patient does not come up for follow-up, and you find that the lesions are increasing. Why? Because he has stopped taking the medication. Who is at fault? The patient. Next is give true information. That means the patient is hiding the information. What will happen? If the patient does not disclose the required and truthful information, your diagnosis may be altered, or you may attend the diagnosis late, the treatment get delayed. You are not responsible for that. You need to make the patient understand these responsibilities. Okay. Now, why I am teaching you all this? Because you will be handling common people. They don't know their rights and responsibilities. It is your job to make them understand what are the patient's rights and responsibilities. Next is respect autonomy of the laboratory staff and treatment with respect with not only laboratory, this is in context with microbiology, with all healthcare workers. Okay? In your lifetime, you will see many patients, so-called entitled patients, will get admitted to the wards. I will only speak with the doctor. Yeah, nurses process को मैं नहीं बात करता. You need to teach the patient that you have to respect each and every healthcare worker, from doctors to nurses to junior staff, even to the sanitary workers. Everyone's work is important for the better treatment and management of your case. Okay. Finally, preserve reports. कुछ पेशेंट आएंगे, हाँ डॉक्टर साहब टेस्ट करवाए, रिपोर्ट कहाँ पता नहीं, खो गया. This should not be entertained. Now, what are the now these were the patient's rights and responsibility. Now the healthcare workers, they also have their own rights and responsibility. वो भी तो इंसान है. Now in microbiological context, that is in laboratory context, there should be provision for safety and protective measures at the working conditions and good working conditions. Because in microbiology, we are handling with infectious organisms. Okay. So you have to ensure that the working condition is such that the people working in the laboratory should not get infected. That is the priority number one. टेस्ट पेस्ट बाद में, जो जा रहा है वो ही इन्फेक्ट होकर आ रहा है तो क्या फायदा हुआ. And also the laboratory staff should maintain the quality of the test, maintain the autonomy of the patient. ठीक है, आपने पूरा कोशिश किया पेशेंट का रिपोर्ट प्राइवेट रहे, कॉन्फिडेंशियल रहे, पर लैबोरेटरी से निकल गया, क्या फायदा हुआ. अब लैबोरेटरी लोगों को कौन बताएगा? आपको ही बताना पड़ेगा. यू हैव टू टीच द लैबोरेटरी पीपल दैट ऑल रिपोर्ट्स आर कॉन्फिडेंशियल. कोई आके बोलेगा इसका रिपोर्ट मुझे जेरोक्स करके दे दो, नहीं होगा. Next, safeguard and dignity and privacy of the patient, maintain confidentiality, and most important, do not falsify the results. Why this is important? एक एग्जांपल देता हूँ. सपोज एक पेशेंट का HIV रिपोर्ट इनडिटर्मिनेट आ रहा है, दैट मीन्स यू नीड फर्दर टेस्ट टू कंफर्म. पॉजिटिव भी हो सकता है, नेगेटिव भी हो सकता है. ठीक है, लेबोरेटरी का कोई जान पहचान का आ गया, बोले अरे इनडिटर्मिनेट छोड़ो, इसको नेगेटिव करके निकाल दो. Suppose you are the operating surgeon and during surgery you get needle prick on the procedure. Try to understand the consequence of a single falsification of report. Okay.